The CDC is now saying, projecting 233,000 deaths in the United States by the end of this month. If you look at the way the major continents are, as the second wave appears to be grabbing hold, you see Europe that's the yellow one, a very sharp rise in seven-day moving average in recent weeks for new cases. Asia in blue, starting to see a drop from the strict measures that have been put in place. On a per capita basis, the US is in the red, again following by Latin America and Europe. Now, as we are months into this disease, there's clearly public fatigue is setting in. A new study by Cigna for young people and for those who are students really shows the measures and the toll that it's taking, not only physical, but social justice, emotional issues, and it leads to the fact that our resilience at risk. The CEO of Cigna is David Cordani, and he's with me now. David, I guess I'm not surprised that our resilience is at risk if we keep getting hit over the head by bad news for 7 months straight, or catastrophic news. But why is it significant?
Good to be with you today. Why it's significant for us, we're a global health service company. And so we exist to be champions for our customers and our communities. And so overall health and well-being ties to how someone feels, the mind-body connection. So we commissioned this study, and the findings were rather startling. Our need to understand that, whether it's for our youth, as you articulate, who go through a natural decline in resilience, it bottoms out, and then ultimately after the age of 2023 starts to come back up, or those who are working who have dislocation from a work standpoint, the resilience goes down and it has an effect on mind and ultimately body from that standpoint. So it's relevant in terms of helping individuals, A, recognize the challenge, and then B, providing new tools and services to be able to better deal when there's challenges relative to resilience. And as a global health service company, we challenge ourselves to do that because we're helping our customers and clients every day around the world.
Right. I get it. Now, I think possibly, and having covered this since the beginning with our working from home series and similar things, and having had COVID myself, I think also this emotional and mental aspect, and what we might call, what is being called the long COVID. But I don't know what you do about it. These are facts and situations. So how can a healthcare company help?
So I appreciate the way you framed it, and I think you framed it wonderfully. The challenging environment, first we have to recognize what the problem is. Second is then we have to say what's within one's control. So tied to resilience, we launched a framework in terms of grow forth. So first off, ground yourself in reality. Secondly, recognize what's within your control. Third, organize the resources that could help you. And then ultimately work within the community, both the virtual and physical community, relative to other resources, friends, family, and others from that standpoint. We have Cigna's resiliency.com has the additional tools and services. That's an example, but it starts with recognition, having a different conversation, and then expanding your use of resources around helping to deal with your own mental well-being, which guides your physical well-being.
David, do you think we are looking at, well, first of all, do you think, as Kamala Harris suggested last night, that if you've had COVID, in the future, health insurers may well regard it as a pre-existing condition, bearing in mind what we are now learning of the neurological, the blood clots, the long COVID? Is it likely COVID becomes pre-existing?
No, I don't believe so. So let's put it into a U.S. context. 330 million people in the United States, plus or minus. Medicare does not take into consideration pre-existing conditions. Medicaid does not take into consideration pre-existing conditions. Before the ACA, the vast majority of employer programs did not take into consideration relative to pre-existing conditions. We've now evolved to a state where pre-existing conditions is not a fundamental way in which the services are rendered. So I don't believe that's going to be an issue from that standpoint, and responsible health service companies have expanded their services around that for quite a long period of time. And COVID will not be deemed to be a pre-existing condition. Let's look at it the other way, Richard. We stepped forward and covered all testing, as long as a doctor called for it. We actually stepped forward and covered the cost for treatment as well for individuals to provide that peace of mind. And we're working within our communities to go the other way to expand services and expand access surrounding it. But no, I do not believe COVID would be deemed to be a pre-existing condition.
David, please, let's agree that you and I can speak before the end of the year again. I know you're a busy man, but hopefully you'll make time to speak to us, because on this programme we're very interested in this question of the long COVID and what's likely to happen. I'm grateful.
I look forward to it, Richard.
You joined us tonight. Thank you, sir.